Dr. Jones, in your office in Orange County, in Villa Park, you also do orthodontic work, braces work,
Yes.
you know, the Invisalign type of stuff.
Yes.
Anyway, you know, shed some light on that. For instance, you know, are you also doing adults with braces? Are you doing only teenagers?
Absolutely. Absolutely.
And what are the advances, you know, which have been made in orthodontics?
Well, there's just been many advances made, Helmut. You know, the research that's been done on what kind of pressures and torques and the engineering part, how our body moves, how our teeth can move. And, you know, it's for everybody. Not only teenagers that might be born with teeth that are misaligned that can be improved, their health can be improved, the function of how they chew can be improved, but the aesthetics, somebody that might be in their 30s or 40s, maybe they had braces when they were a teenager and they didn't wear their retainer and now their teeth have shifted and they want to regain that beautiful smile that they had when they were first done with their braces. You know, those kind of people we help all the time. And then there's the, you know, the 50, 60 somethings that we have that have always had a kind of a looming problem. Maybe they never did have braces. Maybe their parents didn't offer them braces when they were a teenager, but they've always had this problem that they've not liked about the way their teeth look. And they come in and we help them by straightening their teeth. You know, we've had them well over the age of 60 that have had their teeth straightened, and the feedback is just wonderful. It's, you know, I would recommend this to anybody that they say, and why did I wait so long? But we're able to help them, and you know, Helmut, to see the smile on their face when they're finished and they're in their retention phase is just so rewarding, because how many times do you get to finally reach a dream that you've had your whole life? Every time you look in the mirror, you see this problem. Every time for a woman, you go to put on lipstick, or you're a man, you shave and you look at your teeth, or you're brushing your teeth, and you see this problem, a tooth that's crooked, or two teeth that are overlapped, or some kind of a malfunction in your teeth. And you finally now have that taken care of, and boy, what satisfaction that brings.
And worse of it, when you look in the mirror, you see, you know, every time you see it, you know that all the other people you meet throughout the day are going to see it too.
They are going to see it.
You
and
know?
Not only, you know how, it's funny how our eyes work. As human beings, our eyes prefer symmetry. Then if they don't see symmetry or things that are straight and pleasant and beautiful, our eyes are immediately drawn to that. So if you're talking with somebody and you notice that they're looking at your teeth a lot, that's because something's wrong. You know, sometimes, you know, we've all had the embarrassing moment where we have a piece of broccoli or a piece of lettuce in our teeth at the restaurant. But if you continually have a tooth that's out of alignment, or you have teeth that are crossed over each other, or missing, or any of the other problems, and you need to have straight teeth for that not to take place, you notice people watching your teeth. That's what they're looking at, because our eyes gravitate to that.
Good. All right, let's talk something specific here, okay?
Okay.
You know, adults, lots of adults, the reason that more adults now, they fix maybe one or two tooth crooked in front, and they fix it with orthodontic more than before, is because this new thing, Invisalign, came out. Basically, there are like, you know, retainers, very invisible. Apparently, you will tell us how invisible, but, you know, relatively invisible, clear-sighted, and you can put them on. And instead of putting lumineers and veneers on it, and etc., you know, you straighten them out and you have your own teeth, which is preferable. So tell us a little bit about the Invisalign, not only for adults, but also for the teenager. Tell us why is it good, and what's the function, and what's involved in doing it, maybe some benefits, maybe some drawbacks from the normal braces. Because the normal braces have improved quite a bit too. They're not anymore huge metal wires. They're now clear side and all that stuff. So go ahead and...
Yes. Well, the main advantage, I think, to Invisalign is that every day they can be taken out and you can clean your teeth with your toothbrush and your dental floss and the things that you use to clean your teeth on a daily basis. And then and you can clean the Invisaligners and then put them back in place. So that, I think, is the main advantage. But the second advantage that for some people is more important than that is the fact that at conversational distance, I'm talking, 4 or 5 feet, you're having a conversation with somebody and they're close, but they're not, 6 inches away from your teeth. They literally cannot tell that you are wearing Invisaligners or aligners on your teeth. And that is a big, big benefit to most people. They don't want to, even though there's been many improvements made in traditional braces, and traditional braces are still a very, very great tool, is that people that are older, they don't want to look like they're a teenager or that they're trying to look like a teenager. They just want their teeth straight. And so they're really glad that they can snap these into place, they stay in place. People can't tell that for the most part that they have them in place, and they can do that. Now, you asked me to talk about the disadvantage. The one disadvantage to Invisalign is you have to make the decision that you're going to put them in your mouth. So for a teenager, for example, if a teenager chooses to take them out at lunchtime and then leave them out until after dinner, and his teeth are not going to move. So one of the advantages of traditional braces is that they are stuck on your teeth and you can't take them out, and they're there all the time. So that's one thing that somebody has to have already made the decision in their own mind, whether it's a teenager or an adult, that yes, I am going to do this. Yes, I am going to put them in on an average of 22 hours a day. We take them out to eat. We take them out to clean our teeth, brush and floss. But other than that, they're in all night. They're in all day. You learn very quickly to talk with them, and people don't know you have them in your mouth. So there's a very nice advantage to having Invisalign.
Let me ask you on that subject. So let's just say you have that teenager who has his first date. For that much, the 40-year-old guy who has his first date, or he has a job interview, or he meets with the president of China and he wants to make a deal on saving whatever the country, our country hopefully. But anyway,
sure.
So he has this all-important appointment, is what I'm trying to say. And if he decides to leave it out for that one evening, for that 1 3-hour appointment, that's not the end of the world, is it?
No, it's not the end of the world. And I tell people all the time, if you're going to some huge social function, then you may choose to take them out. But just know that your teeth are relapsing back, as you speak. And the minute you put them back in has got to be the first moment that you're no longer in that situation. So let's take the guy on the date. So he goes out on the date with his girl. It's 2 or 3, 4 hours long. And immediately when he drops her off, gets back in his car, he's going to need to put those aligners back in place. He's got to be committed to that. Or the presentation you're making to save our country. You want to take them out before you go in and present your best effort. Absolutely, you're going to want to do that. But the minute you're done, you're back in your car, you're on the plane back to your home state, wherever that is, you're going to want to put those back in, and you're going to want to continue that treatment. Why is that? Because if you do that in not a very long time, maybe 6 months, 9 months, a year down the road, you won't have to wear them anymore because now your teeth are going to be straight. But if you take them out for 4 or 5 hours every day, or one day it's 8 hours, and then the next day it's 10 hours, then one day you forget to put them in altogether, your teeth are not going to get straight very fast, and you're just going to be spinning your wheels. So you're right, Helmut. To take them out for that one important time every once in a while, that's not a big issue. But if you do it all the time, your teeth are just not going to move to where you want them to be.
Maybe I should apply your principle of keeping at it with my exercise, a kind of one time missing it, no big deal, and one time it turns into a whole summer, and then when I go to the ski slope, I go, what happened? Why do I have no strength?
And me both. That's right.
Right, but what about the child, teenager, who, and that could of course happen to an adult, lunch, put it aside, falls down, step on it, breaks. Can it be replaced?
Absolutely. That's one of the nice things about the aligners. They're computer generated. And so we always have the patient keep the aligner that they had prior to the one they're now wearing, so that if God forbid they lose it, which I'm sure has happened at some point. None of our patients, fortunately, have done that. But they can always put just the last one that they just had 2 weeks prior to that in their mouth. And while they're waiting, we can call the Align company, and they can generate a new set of just that one set, and we can have it in our office within 2 days. So it's not really a big deal to, if somebody happens to lose one, to replace it. All the information is held in the computer. It was all generated by a computer. It was all cut by a computer. So when it's time to have another one made, another one's going to be made exactly like the one that was lost or misplaced, or some people even get them chewed up by their pets at home, the dog or the cat. They'll love the Invisalign, and they'll chew it. But
they can be replaced. So now, a last question here. Like you mentioned something about, obviously you take them out and you brush your teeth so you can brush them. Well, with a normal braces, brushing is a lot more difficult. Not impossible, but it is a lot more difficult. And sometimes, if and when people are a little bit on the flaky side with their brushing, flossing, and especially when they have braces, because now it becomes a very tedious thing, I suppose. I never wore braces, so I wouldn't really know. Then the braces might come off, the teeth are straight, but now we're having a gum disease, and we talked about gum disease. So if there's a gum disease developing over a time, which maybe you as a dentist will take away from it as you do it because people see you every month or so, but is that a big advantage of being able to brush the teeth?
Absolutely. That's why, Helmut, that's why I mentioned that as the first advantage, because you can clean your teeth by popping out the aligners and brush and floss the way you would normally brush and floss. You don't have to have little special tools to go in between the braces and under the wire and over the bracket and spend 5 or 10 minutes cleaning your braces that have been attached to your teeth. So I listed that as the number one advantage. The crime, in my opinion, when teenagers that aren't very good about brushing and flossing have braces in their mouth. And I have seen this, Helmut, and it just really is devastating. The braces come off, and there's decay and gum disease around almost every tooth in their mouth. And it's not the fault of the orthodontist or the dentist who's doing the braces for them. It's because they just have gotten into the habit of not brushing and not keeping their teeth clean. And they may brush really good the day they go in to have their braces adjusted or tightened, and so the people there can't really see all of the devastation. But when it's too late, the braces come off and there's decay underneath the braces where nobody could see before. And I've seen that too many times, that aligners, the Invisalign process, really is a great advantage for that reason alone. There's also been something that's come with aligners, and that's compliance buttons. And it's a little tab that's inside the aligner that if you don't wear them, it won't change color. And so I can tell as a dentist if you haven't been wearing them. And so you come in and you say, wow, my teeth aren't moving very much. And I look at it and I say, well, it's because you haven't been wearing it. So I know now for teenagers we can do that. But there are many advantages. And I think the number one advantage is that an aligner can be removed. The teeth can be cleaned properly so you don't have that increase in decay and gum disease that may unfortunately come with traditional braces.
Great. And with all those advantages of Invisalign, sometimes a person still needs the normal regular braces simply because he needs them. But I would suppose every dentist who knows how to do orthodontics will know that and will make that evaluation at the time. And then there, of course, are some kids, they want braces because they want to wear their local football flag on their thing, on their little stuff.
That's right.
So,
that's correct.
Choices. It's wonderful. Okay, Dr. Jones.
All risks and benefits.
You enlightened us well again. Thank you very much.